Thanks. Hey, Dr. Melanie Palm joins us here this morning, and in honor of Thanksgiving, we're getting rid of the turkey neck. Dr. Palm, what is turkey neck?
Well, I think that can describe a combination of things. In this case, we're talking about fullness or submental fullness, that double chin underneath the jawline
Well, let's
area.
just take care of one of my double chins today.
Okay.
Okay, so this is a process called Kybella.
It is.
That's the name of the product.
Yeah.
Made by the same folks as...
Yeah, so we were just talking about Allergan, and both of those products are actually made by that company. So Kybella's been FDA approved just this year. It was a huge study, over 1,000 patients, really good, well-done study that showed significant reduction in fat underneath this area with the product.
This is a permanent solution as long as you don't gain back a bunch of weight, because those fat cells are absorbed and then eliminated from the body, and they're gone.
That's true. So it's deoxycholate. So it's actually a natural occurring substance in our body. It's a bile acid. So its job in the body is to break down dietary fats. It would make sense that we would inject this in areas of unwanted fat to actually break it down.
Okay, so you marked my chin. This is what you would do with anybody. You would come in and you would take a look at what's going on underneath there.
We cleaned you off, and we actually marked important anatomic landmarks. So you really want to go to a board-certified physician that knows where they're injecting.
You're actually training other physicians in this. I should point that out. You're the certified trainer in this area.
I am. So I train other board-certified dermatologists and plastic surgeons on the technique. And then we took this grid, and we actually put that underneath mark your chin and transfer that. So I've got a little grid of dots.
So we've already done that. Okay, so this doesn't require numbing or anything in the process.
No.
Maybe a cold compress or something ahead of time.
Or a special squeezy ball.
Oh, this is... Okay, that I will take. This is for you.
Yeah, so we do a little cold pack before, and these are going to be tiny little pokes. It's going to feel like a little bit of warmth, and so that little grid that's been supplied for me helps guide me in terms of injecting it. You know what, an average injection session takes maybe 2 to 3 minutes to do, and we're injecting into what's called prepalatismal fat. So it's the fat that when you swallow, I can still grab onto. So it's the fat that's in front of our muscle in our neck.
Now this doesn't, I'm reluctant to talk only because you've got a needle, but it doesn't, there's no pain at all.
Yeah, I tell patients sometimes there's like a warm tingling sensation. We're actually halfway home.
Almost nothing. I mean, that's really amazing.
Yeah. And so what's so amazing, for patients that, maybe they would be a good lipo candidate, but they're not ready for surgery, or they're just not a good candidate because of other medical conditions that are going on, this is a viable option. Or if people just don't want the downtime of a larger procedure, this is a way over a series of treatments. It's usually done, in the study it was done monthly, but what we're finding in clinical practice is it makes more sense to do it every 6 to 8 weeks. We still think you're getting a benefit from a single injection through about a 6 to 8 week period. So
is that it?
Yeah, that's it.
Wow. Okay, so that's all there is to it.
That's all there is to it.
Well, I didn't even need my squeezy ball.
Good.
But I'd like to keep it anyway.
All right, you can.
Now, doctor, again, about how long before folks start seeing results from
So I tell patients 6 to 8 weeks. You may start to see a difference even with the first one, but usually we recommend between 2 to 4 treatments. And then the amount we used 1 vial on you. You just have a little bit. This is best for patients that have mild to moderate fullness under here, but have good skin tension. They have good elasticity. They don't have a lot of laxity.
Okay, very good. Now, there's a couple of other things that you can do that are pretty simple, that don't involve invasive surgery and drastic procedures. What else did you bring?
We brought sort of non-device things. So Botox and Dysport and Xeomin, the 3 botulinum toxins, can actually be used in the vertical bands that are on your neck.
Well, I got that going too.
So we can actually inject that, and it relaxes it and helps smooth the neck.
Interesting.
And then I also brought microneedling. That's becoming so popular. It's done by my esthetician and nurse. We actually have a device that I just use myself that's a little bit stronger, but this is used usually monthly.
By the way, you have perfect skin.
Thank you.
You're welcome.
As a series of treatments, but it builds collagen. So, thinking about things that help with the fat, helping with the muscle, and helping with skin texture.
Very good. Well, thank you for allowing me to be the guinea pig to demonstrate on today. Again, folks, it is perfectly comfortable. Yeah. I mean, if you can be on TV and talk through the segment, that's probably a pretty good indicator. And your doctor can continue to talk you through the process. Where can folks come see you?
I'm in Art of Skin MD.
Art of Skin MD. It's Dr. Melanie Palm. And again, thank you so much.
Oh,
and
you're
happy
welcome,
Thanksgiving.
Mark. Thanks for being such a good patient.
It'd be great if I actually walked out of here and screamed off camera. But I'm not going to, I promise you. It's perfectly fine. Okay, enjoy the holidays at a